Did you know that 8 of the top 10 leading causes of death in the United States can be prevented if identified and addressed in their beginning stages? Eating more plants, high in fiber foods, exercise, stress management, and health screenings are vital to preventing disease, decreasing death by disease, and reducing healthcare costs as we age. I get we're only in our 20s, guys, but soon we're gonna be in our 30s and 40s and 50s and 60s, and what we do today is gonna determine the life we're gonna have when we're 60. Well, if that ain't a mic drop, I don't know what is. What's up, super foodies? My name is Tessa. I'm a licensed and practicing pharmacist as well as a certified personal trainer and nutrition coach. And I'm all about helping people live a happy, healthy, full potential life using supplements, superfoods, alternative therapies, and pretty much anything wellness under the sun. So let's get into it. Plants, plants, plants. Let me say it again one more time. Plants. Did you know that eating a plant-based diet can lower your blood pressure by 28 points or more? And when compared to those eating a standard American diet, those eating a whole food plant-based diet were on average 36 pounds lighter. And as an individual's diet become increasingly more plant-based, appears to be a stepwise drop in diabetes rates. If there is one thing that pretty much all healthcare personnel can agree on, is that we need more plants in our diet. For me, I personally use the Daily Dozen app developed by Dr. Michael Greger from nutritionfacts.org, and I use that because it ensures that I'm getting my daily recommended amounts of fruits and vegetables, plus it's on a checklist, and you know me, that type A personality, I just freaking love checking those boxes. The second one is high intake of dietary fiber. Fiber-rich foods help prevent obesity, diabetes, cardiovascular diseases. Increasing fiber just 7 grams a day was associated with a significant 7% reduction in stroke risk. And 7 grams is relatively easy. My dad had a stroke when I was a freshman in college, and I can honestly say that it was one of the most scary experiences in my entire life. I had no idea what was going on. I was 8 hours away from home, and I don't want you, your parents, your loved ones, anyone to ever have to go through that experience. And plus, if you really don't want a stroke, then we should really try to get at least 25 grams of soluble fiber a day, and those are found in beans, sprouts, nuts, oats, berries, things like that, and at least 47 grams a day of insoluble fiber, primarily found in whole grains. Now, I understand one would have to have a very healthy diet in order to get that much, but eat fiber and prevent disease, or take the chances of fate. Which one are you gonna choose? Next one is exercise. So obviously exercise can help with mental health, cognitive health, sleep quality, cancer prevention, immune function, high blood pressure, and lifespan extension. It was a lot to say in one sentence, but I made it. If the United States population collectively exercised enough to just shave off 1% of our nation's body mass index, 2 million cases of diabetes, 1.5 million cases of heart disease and stroke, and 100,000 cases of cancer would be prevented. That's insane. So ideally, how much should we exercise? So according to the 2018 physical guidelines for Americans, there are 2 types of physical activities that adults need to participate into in order to improve their health: aerobic exercise and muscle strengthening. So moderate intensity aerobic activities, so that would be like brisk walking. They want you to do that for about 150 minutes every week. So for example, 30 minutes a day, 5 days a week. On top of that, doing muscle strengthening activities 2 or more days a week that work all your major muscle groups. So legs, hips, back, abdomen, chest, shoulders, and arms. Or the other thing that you could do is vigorous intensity aerobic exercise. So jogging, swimming, biking, XYZ, there's a whole bunch of different things for 75 minutes. And then once again, adding on the 2 or more days per week of the muscle strengthening exercises. The current recommendations for 150 minutes of moderate intensity exercise appears to reduce overall mortality or death rate by 7% when comparing to those not exercising. However, walking 300 minutes a week, so doubling that, drops overall mortality by 14%. So walking twice as long yields twice the benefit. And walking for an hour every day may reduce mortality by 24%. So obviously going beyond will allow you to gain more health benefits. The next one is stress management. So prolonged stress puts your body in this continual state of this fight or flight response. So when your body has no time to reestablish its balance, it becomes overworked and your immune system weakens, making you very susceptible to illness, and our risk for health problems increase. Things like memory impairment, depression, skin conditions like eczema, difficulty sleeping, obesity, heart disease, digestive digestive problems, autoimmune diseases, so many things. I cannot stress, see what I did there? Stress. I cannot stress to you how important stress management is. So to help manage your stress throughout the day, it's really important that you release that physical tension by standing up while you work, taking the stairs, taking a 5-minute walk break even, listening to relaxing music, whether you're on your commute, you're at lunch, or even at your desk while you're working. Talk about stress to someone, whether it be a loved one, a close friend, a counselor, a therapist. My favorite stress relieving activities, of course, is exercise. So it's a double whammy. You get the benefits of exercise and stress management. I love doing cold exposures, so nature walks, just getting in with the trees, getting outside, breathing in some fresh air. And of course, meditation is a huge part of my stress management routine as well. Now, before I move on to health screenings that you should be participating in or completing with your provider, it's really important to do the best that you can and then do better. So when it comes to diet, exercise, stress management activities, putting too much pressure on yourself can be counterproductive. So it's really important to start low and go slow and build upon that. And if you mess up occasionally, that's fine. That's part of being human. I can sit here and tell you until I'm blue in the face that a whole foods plant-based diet is the best way to go according to the literature. But if that's not sustainable for you, then what's the point? Do what you can and what's right for you. And once you've established that healthy habit, build on it and continue to push yourself to be healthier at a pace that's sustainable for you. So what are the other things? What are the health screenings that you need to be doing in order to catch those diseases at their earliest stages so you can prevent them? For our women, breast self-exams and mammograms. So monthly self-breast exams, really important. There are plenty of instructions on how to do that and how to perform them on YouTube, so go check them out. It's really important to contact your doctor right away if you find any abnormalities in your breasts during your self-exam. Normally mammograms they're not really recommended until you're 40 unless you have an increased risk, so like a family history. The next one for our ladies, a pelvic exam and a pap smear. So beginning at the age 21, a pelvic exam and a pap smear is used to kind of check for cervical cancer, especially when you're sexually active. If the exam goes well, you won't have to check it again for another 3 years, and then eventually every 5 years once you reach the age of 30. The next one is blood pressure. So it's recommended that you get your blood pressure checked every 3 to 5 years, but honestly, I would do it like twice a year. High blood pressure leads to so many issues, so many chronic diseases. Rather do it twice a year, catch it early so you can change your lifestyle habit to reduce it, to prevent it from increasing further. The next one is cholesterol screenings. So usually it's recommended to start at age 20 to assess for heart disease, kidney problems, potentially diabetes, but it's not the main test for diabetes. Some doctors will look at you and they'll be very confused why a 20-year-old is coming in to check their cholesterol. But once again, I mean, I would way rather know about my cholesterol status earlier and continue with my lifestyle habits if everything is clear than wait till I'm 30 and all of a sudden I have to be put on a high cholesterol medication. So after the age of 20, it's typically rechecked every 5 years if your cholesterol is within the normal range. And the last one is a yearly physical. So this is all encompassing everything, and most of the time a yearly physical will also include all of those exams if you're due for them. And then I would also add on, sometimes doctors don't do this, so add on a skin check. Ask your doctor to check your skin for signs of skin cancer. So I never thought that I would have to worry about skin cancer. That never crossed my mind. I never tanned. I never really sat out in the sun. I always put sunscreen on. And it turns out when I went in, oh gosh, I don't know if that's like 2 or 3 years ago now. I don't know when it was. Turns out I had 2 moles that were very, very close to turning into skin cancer. Like they were at the stage before it would be considered skin cancer. So if I didn't take the time to see a dermatologist, you know, I could be living with skin cancer right now and I would have no clue. I've got a large scar on my back, on my shoulder that reminds me constantly, Tessa, get your skin checked. Bottom line, we have one life. We have one body. We have one mind. We need to treat it right now so we can develop these healthy habits so that in the future, we don't have to deal with the overwhelming anxiety that comes with being diagnosed with a chronic disease. I see it all the time in my patients, whether I'm at the pharmacy, I'm at the hospital, I'm at my ambulatory care clinic site. It's so overwhelming for people and I don't want people to experience those things. Let's create the healthy habits now so we can be healthy, run around with our grandchildren, with our family when we're 60, 70, 80, 90. Tessa wants to make it to 100, okay? I think that would be so cool. So that's why I'm implementing these things right now. If you want to work with me one-on-one on my 12-week lifestyle revamp program Remedy, or any of my other services that I offer, check the link in my description below. That will lead you to my website where you can put like a little message to me, and I'd love to work with you one-on-one, coaching with you, providing you information, all sorts of different things to help you create those lifestyle changes, because it's one thing to say that you're going to, and it's the next thing to actually implement them and how you're going to implement them in a way that's sustainable for you. Thank you guys again so much for watching. I hope you found this helpful. If you want more daily tips, tricks, hacks, and things like that on all things wellness utilizing my pharmacy brain, personal training, and nutrition coaching, head over to my Instagram at the Superfood Pharmacist. And of course, if you like this video, make sure to hit that like button, hit subscribe, hit that bell notification so you can be notified every single time when I upload a video, which is every Sunday. If you have any questions, leave them below in the comments. Send me a DM on Instagram if there's anything you want me to go over, cover. Put those in the comments. I'm here to be a resource for you guys. Thanks again, and we'll see you next time. Bye.